Now, we have to assess one eye at a time. So we ask our patient, please cover one eye. Make sure when they cover the eye, they do not press on the eyeball, otherwise the image will be distorted. So what you can tell them actually is, like make a cup with your, cup your fingers this way, so that when they cover it, it's going to be this way. If your patient is wearing glasses, ask them to take it off. If they're wearing contacts, take it off. Okay, so, okay, which line can you read very clearly?
PEZOLCFTD. Oh, 11.
Okay, 11. Okay, so she can read line 11. Let's pretend, okay. Pretend, that you can only read until line 8. So tell me.
DEFPOTEC.
Okay, so if, for example, the patient says, I can read clearly line 8, go down to line 9. Okay, and can you please read?
LEFODPCT.
Okay, so if she still is able to read it, then you go down a line. Okay, remember, this is not 20 feet. Okay, now if, for example, when she was reading line 9, she made a mistake. She said LFPODPCT. So she had two mistakes. So meaning we would document that as 20 over 15 minus 2. Okay, you do not deduct. The 2 reflects the, what they call is the missed letters. Okay, so you do not deduct, just put it that way. Okay, question so far? Okay, when we test now the other eye.
My phone's broken.
No, she's crying. Okay, which line can you read clearly?
I can read 11. PEZOLCFTD. This eye's bad.
Okay, so that is, she got it right, so that's 20 over 10. Let's say she made a mistake in one letter, so 20 over 10 minus 1.
No, 20 over 11. It says 11 down there.
No, you're looking at the fraction here.
Oh, that's just line numbers. Oh, okay.
This is the line number, these are the fractions. So
Okay.
when you record or when you document 20 over 10, 20 over 15, etc. You're looking at this. You're asking her which line she can read clearly. Okay? All right. Then we move on to. So she will now, you will now test her near vision using the Jaeger chart. So if you remember, okay, this is two-sided. Okay. So as the patient cover one eye, okay, hold this about 14 inches away. Can you read number 7?
Able to read those.
Yes. Okay. So if she can, flip it. Which line, which number can you read?
I can read number 1.
Okay, just read one.
In the
first
2nd
line.
century of the Christian era, the Empire of Rome comprehended the
Okay, so she can read this top here. Okay, so now we check the other eye. Again, hold it. Okay, can you read number 7?
Yes.
Flip it. And which number can you read clearly?
Number 1, in the 2nd century of the Christian era, the Empire of Rome comprehended the fairest.
Okay, so here's the thing. If, for example, your patient is unable to read this side here, okay, and she does, okay, that's the presbyopia. In some highly myopic persons, in some highly nearsighted persons, if they hold it at 14 inches, they cannot read it. What do they need to do? They need to bring it closer. That means they're really myopic. Myopia is being nearsighted. Okay? Right. So we now test for the peripheral vision. Okay. You have to move on to So you position yourself 2 to 3 feet away from your patient. Remember, you have to be like at eye level, okay? And like we said, this is on the premise that me, the examiner, have intact peripheral vision. Okay, so you tell your patient, just look straight ahead. Okay, I will move my hand here and there will be these fingers. When it comes into, when you see it, say now. Okay, cover one eye, please. Opposite eye. Okay, so just tell your patient, cover one eye and you just cover the opposite eye. Okay, so just look at me. Okay, so that's superior, that's 50.
No.
That is temporal, that's 90.
No.
That is nasal, 60.
No.
That is inferior 70. Okay.
Why
So-
you cover your eye? I'm sorry.
Because you have to check, because Tina has good peripheral vision. If you have a patient who you think has this peripheral blindness, so when you see in your fingers and the patient is not able to see it yet,
Oh.
Remember the car? She
Oh,
said.
you're doing your own check at the same time, kind of to make right.
it's like your
Yeah.
vision is going to be the basis.
Oh, like I see it, why don't you?
So that's the thing. That's why we say it's on the premise that your peripheral vision is intact. Okay. And please, I know that some of you, when you're sitting with your partner, that's why with Ina, I have not even moved it. She can already see it. That's fine. Okay. But please stretch out the hand. Do not go, can you see this, Ina? This one. Okay. Because this is not peripheral yet. That is peripheral. Okay. So please stretch out your hands. The arms all the way up. Okay. Do not limit it to just this area because we want to assess all the way from there. Okay. So now we test the other eye. Always test both eyes. So please cover the other eye. Okay. Again, just look at me.
No.
Superior is 50.
No.
Temporal is 90.
No.
Nasal is 60.
No.
And inferior 70. Okay, so that is for our peripheral vision testing, confrontation test.
What if we get it? What if I don't see it until later? What do we call that?
Then you just say there is peripheral
Obstruction.
peripheral blindness superior
Oh, okay. To wherever which one it was.
on the right or on the left. Okay, and then we now do our corneal light test. Okay, in the corneal light test, you have to come here because you will not see this. It's good that you volunteer because you have lighter colored eyes. They may appreciate it. Okay, so here's the thing. Okay, you shine the light about 30 centimeters away, just at the bridge of the nose. So just look straight ahead. Okay. Do you see where the reflection of the light is at?
The corners of the eyes, the inner corners.
Huh?
No? I don't know. I'm holding two things
Okay.
here.
Look, there is no reflection yet of this light. Look now. You see the reflection is like that star in the middle. Okay, does it fall on the same spot? Yes?
Yeah.
Yes. Okay, I'll show
No.
it to you. Can I have someone sit here? So that don't need to take off their glasses so that Tina can see. Okay,
I need this.
you have to face her. Oh, okay.
Sorry.
Just face her. Okay. So just look straight ahead. You see the reflection of that light?
Oh, and right by her pupil, right?
Yes.
Oh,
yeah,
okay.
I
So
see 'em.
that is what we're looking at.
And they're in the
That's-
same spots.
Mhm.
Okay.
So the color, the reflection of this will be yellowish. If you're looking at the reflection from this, it's going to be whitish, but this is what we're looking for, the reflection of this light. Okay, everybody saw that? Okay, so let me saw it?
Yeah.
Okay. Then we now do the cover uncover test. So here, ask the patient, no, just look straight ahead. Okay, look at the eyeballs. Do not look at this, look at her. Okay, just look straight ahead. Do you see any movement in the right?
No.
No. Okay, I'll take off this cover. Any movement? It was very minimal movement. If you were
I
really
didn't see
looking,
it.
you could see it. Okay, so that is the normal finding. Okay, so again, just look straight ahead. Any movement on the left?
There was no movement.
I saw it.
Yeah, there was a very minimal.
Because she moves. So if I'm focusing on something and you move, I try to.
No.
I
But
shouldn't.
it like
Oh.
It goes that way, just a
Oh,
little,
okay.
because you're just
Really?
you're just
Adjusting?
adjusting the focus. Okay,
Let's see.
that's so she can see. Because the others have glasses, so they have to take it on and off.
Yeah, yeah.
Okay, so
Okay.
just look
Do this.
straight ahead. Okay,
What eye am I looking at? Oh, this one.
is
Right?
that eye?
Oh, there was nothing.
There was
Okay.
nothing.
So it's supposed to
Yeah.
be a fixed, the gaze is steady
Mhm.
and fixed. Okay. Just look straight ahead. No smiling, please.
She's not.
Don't say that to me. I'll
Okay.
smile.
Okay.
Mm-mm.
There's no movement.
There should not be any movement. If you do see it, it's going to be very, very slight. Okay.
Mhm.
Because you have normal muscle alignment. If
You know,
you
it's
see
not normal.
something that goes, then that would be abnormal. Okay, so that's the cover uncover test. The next one would be the cardinal fields of gaze. So again, just look at this. Okay, follow it with your eyes without moving the head. Okay, so that's the 6 cardinal fields of gaze. You see the movement is very smooth and coordinated. Now,
So wait, you go right, left, or
One,
So,
one, two,
superior,
three,
Oh.
four, five,
middle,
six.
and then inferior.
oh,
Okay.
up,
Now you
middle.
always start from the midline, go up, back to the midline,
Oh.
sideways, back to the midline. So you do not go.
Okay.
Okay, there will always be the midline going up, back, out, midline, out, midline.
Okay.
Okay. So do it like I always say. You have to put a certain order to it so you don't forget. You don't just go. Otherwise, you will forget what you missed out on a certain feature or a certain angle. Okay. Now, have you seen nystagmus? Nystagmus is jerky movement of the eyeball.
They like
Yeah.
go left to right.
It's like twitching.
Okay. So we will elicit that. This is where she does not have nystagmus, but we will elicit it so that you can see what it looks like. Okay. Look at her eyeball very well.
Okay.
Or do you want me to look this up then?
Just look at the pen. Follow it. Did you see the movement of the eyeball?
Mm-mm.
Yes, no?
Mm-mm.
Wait, now there's something in your eye. I'm sorry. Okay.
Okay, again.
Mhm.
Oh, yeah.
See it?
Yeah.
Okay, so it goes,
I can see it.
it twitches.
To try to
Okay.
get there.
Yeah, because the muscles will try to focus on the object, but it's too far now, and so the eyeball goes. Okay, in an effort to adjust to this. Come here, so you can see. Okay, so 6 cardinal fields of gaze first. Don't bring it too near. Okay, and then let's elicit nystagmus.
Oh yeah,
Yeah.
even her eyelids kind of did it,
Mhm.
right? Like.
So that is nystagmus. Everyone saw it?
Can you do
Okay.
it one more time? The
Yeah, I
last
didn't
one?
see it, to tell you the
The
truth.
last one. I'm sorry.
I didn't see it at all either.
Watch her.
See
Hmm.
the eyeball? It goes. What is it that you saw it? Okay.
Like you said, even her eyelid.
Like their eyelid kind of does it too, like
Mhm.
right?
Hers, but for some it's just the eyeball,
Eyeball.
that really will be very prominent.
Yeah.
Oh,
her
okay,
whole
yeah.
eye
You
thing.
see that? But you can.
It's
yes,
trying
it does.
Because you're like,
It's trying to
Move your hand again.
compensate.
Yes, it does hurt because it's like pulling. The muscle is pulling to make sure that they can.
yeah,
it
that's
can
what
still
it feels
focus.
like you're
Mhm.
pulling it.
Uh-huh.
Yeah.
So that is nystagmus, the twitching movement of the eyes. Okay. Next, after the cardinal fields of gaze, then we check the eye structure. So we check the eyelids. Okay. So just you don't need to touch anything yet. So you'll notice that the eyelid margins, they're pinkish, they're moist. You see the eyelashes, they're distributed evenly throughout the lid margin. The eyelashes are oriented as it should be, upwards and outward, downward and outward for the lower. Okay. Then we assess the conjunctiva and the sclera. Okay, so please look up. Okay, so you see the palpebral conjunctiva.
Mm-hmm.
You see the sclera. Okay, it's bluish white, and you have those blood vessels, the capillaries. Okay, and then look down. Okay, so now you're checking the bulbar conjunctiva, and you're checking the superior aspect of the sclera. Okay, now we assess, let's see, the cornea and the lens. The cornea and the lens, I'll just bring it this way. You shine the light tangentially, so just look straight ahead. Look here. Come on, look. Here on this side. Do you see the transparent membrane?
Yeah.
Yeah, the vessels.
No, the transparent membrane, it's like a film.
Mm-hmm.
Okay, so that's the lens.
Mm-hmm.
Okay, and then the cornea is just anterior to it. It's like a brownish pigment just anterior to it. That's the cornea. Okay. Everyone saw it? Okay.
One second.
Wait, let me
Okay.
that you can see. Just look straight ahead.
Oh, you can see through the.
You
Yeah.
can, Can you see the cornea and the lens? The lens is the transparent. It's like a film, and then you have just anterior to it a pigmented area. That's the cornea. Okay.
It's like right in my face.
Okay. So that is for the cornea and the lens, and then we check the iris. So do you see the color of
Yeah.
The iris is
Oh,
the
yeah.
same on right and left eye? Same size? Okay. And then we assess the pupillary reaction. So we said direct and then consensual. So I will shine the light on the right eye, check for pupillary constriction on the right pupil. Okay. So just look straight ahead. Okay. Now, I will do the consensual, check the constriction on the left pupil. Okay. You see it? Yes? So again, direct, and then consensual. Okay, remember, the light does not cross the bridge of the nose. It stops right here.
Where? It stops here,
Here,
or
just here on the
on
eye.
the
Uh-huh. So you don't need to let it cross because we're assessing the consensual, the afferent reflex. Okay, so this one here now. Direct. Consensual.
So the consensual is just past a little bit.
No. It's just
Oh,
right
well.
there.
You're checking the other eye. Like this eye should try to constrict.
You
with
just
this
don't
eye.
pass this part of your
Same
nose. You
place.
don't pass it.
The same place.
Okay.
Okay. And then you do the accommodation. So in accommodation, okay, just start farther away. Look at her eyes. Bring this towards the bridge of the nose. Look at the light. See the convergence
Yeah.
and the constriction.
Is her eye supposed to go in like
Yes.
When you
Oh,
do,
yeah, then
take
you
your
get
finger
kinda-
and follow your
Yeah,
finger.
like,
When I was a kid, I used to do it like this.
Yeah.
Okay. Okay, so do the pupillary constriction first. Okay.
Direct,
And check the other eye.
consensual,
So again
the
here.
same thing. Direct. It's just hard to see there because the
'cause
light's
there's no
not
light.
there,
Uh-huh.
and
Yeah, I
I'm
don't
seeing my
understand what
reflection of
you're saying.
myself in her. Okay, so can I explain to her?
Yes.
So direct is she's gonna take this and she's gonna go. We're gonna check this direct eye. Maybe that'll help you.
Okay.
So if we take the light and we go like that, see how it got
Constricts.
small?
Okay.
But now I'm gonna see if this one is gonna do the same thing, even though you're still doing the same eye. So you're gonna come this way, but you're gonna look at the opposite eye now.
Okay.
Now this one consensual. You see how that one constricted too, even though I'm just putting the light in that eye.
Okay.
Okay? All right. So,
Oh, wait, we're not.
we now assess for accommodation. Okay. That's why it's nice if you have the light colored eyes.
Oh,
So
okay.
even without the light, you will be able to see the constriction. Mm-hmm.
Well, because the
Okay.
pupil's black and it's more prominent.
Uh-huh. So, let's look.
She's gonna fight it.
Stop
Follow the
smiling.
light.
See the convergence?
Yeah,
The
yeah, yeah,
constriction.
yeah.
Okay, so it's
Constriction
slowly-
with conversion, right?
Uh-huh.
You're
So
like,
that is accommodation. So we always say pupils 3 to 4 millimeters or 2 to 4 millimeters equally responsive to light and accommodation.
Perla.
Perla, yeah.
Mhm.
So we're testing Perla.
So what does PERLA mean?
Pupils equal, round, reactive
reactive
to light,
light,
and accommodate.
But we always have to take the measurement. We always have to include what is
So
the measurement?
3 to 4.
About 3 to 4, 2 to 4.
Normal.
Okay. So after this, you now assess the puncta. Here is the puncta. See the opening there?
Yeah, the little hole.
Yeah.
Okay. So on the upper lid, you will also see.
There's one up there too?
I didn't
Oh,
know that.
yeah.
I didn't know that either.
Oh.
See it?
like a tear.
It's like a little
And the lid, right? On
Yeah.
the lid.
I thought it was
Yeah.
Okay, look down.
I see it when you do the eyeliner.
Here. See it?
I don't wear eyeliner. That's why.
So that's the puncta. So make sure that it's clear, no obstruction, and then we press here. See if you can express any discharge, any fluid.
On top.
Okay. And then the last one will be the use of the ophthalmoscope. Okay, like I said. Okay, you and your partner will work here. This is where we can turn off the light here, so it's going to be dim enough, and then I'll show you how it works. I think that's a better option rather than showing you what to do, and then so you can practice, and then try to, like I said, the first thing you'll need to look for will be the red reflex. It's going to be really red. Okay, and then bring your ophthalmoscope closer to the eye until you see those vessels, the blood vessels. Okay? All right, that's for the eye. Okay, who wants to start with the ophthalmoscope? The rest you can practice the other